Good morning, SRES Networking Meetup Group. I'm so glad to have everybody here. Thank you for joining us today. Today we are blessed to join us with Michael with Familiar Surroundings Home Care. We're going to get the latest and greatest update on the business of home care and everything we need to know in service of our senior homeowners and the families of senior homeowners. So go ahead, Michael.
All right, well, I'm going to try my best to give you the information you're looking for. Julie and I talked about a few different things on the topic, and so if I start talking about one that doesn't seem to be exactly what you were looking for, please stop me, and I'm happy to change directions. I know most of you are muted, but I do have you on gallery view, which I finally figured out how to do. So if somebody has a question, please speak up, wave your hand, yell at me, whatever. I'm happy to answer questions. Typically, when I do presentations like this, there's more information gained from the questions themselves rather than just me droning on. But I will drone on until somebody stops me. Basically, I am Michael from Familiar Surroundings Home Care. We are a family-owned and operated business. We've been in business now for about 15 years. My wife is the actual owner of the company. She should probably be the one doing this presentation because she is a certified senior advisor and a wealth of information. But I got asked and she didn't, so here I am. Like I said, we've been in business now for about 15 years. One thing that is a little bit unique about, and I shouldn't say unique, that's not really the right word, but there are different types of home care agencies out there. And it's important for people to understand that there are differences to us. We're what's considered a full service agency, which means that we're licensed, we're bonded, we're insured. All of my caregivers go through DOJ and FBI background checks. They go through DMV checks if they're going to drive for us. There's other types of agencies out there that are what are called referral agencies. And if you watch TV enough, you've seen Joan London talking about home care, and the company that she endorses is actually a referral agency. And the difference is they find you a caregiver rather than a group of caregivers. There's nothing wrong with going that direction. There's some upsides and downsides to using either types of agency, and I'll go through those a little bit more in a second. And then the other way that people get in home care is they hire private caregivers, and that could be somebody that they just hire, off of a Craigslist ad or a friend of a family member or something like that. The main differences between the three types of agencies are if you work with an agency like mine, again, like I said, we're licensed, bonded, and insured. If something goes wrong, we are responsible. We're also responsible for payroll taxes, workers' compensation, all of those sorts of things. Whereas a referral agency or a private caregiver, you actually become the employer, or in this case, your clients become the actual employer, and they're responsible for all of those things. So that just to highlight the differences in the types of agencies. The other benefit of using a full service agency like mine, if a caregiver calls in sick or goes on vacation, something of that nature, it's my responsibility to find a replacement. Whereas if you have a single caregiver, either from a referral agency or a private hire, that's what you have. You have a caregiver. And again, there's pros and cons to both. And it comes down, oftentimes it comes down to where your client wants the liability to land. And oftentimes it comes down to pricing as well. Julie mentioned pricing, and I'll just explain the differences between the three types of agencies. My agency, we are around $45 an hour is about what we charge for in-home care. That price can go up or down ever so slightly, depending on the level of care that we provide. Some of my clients just need some supervision and companionship, and they're on the lower end. Some of my clients need a lot more. They may need help with personal care, bathing, dressing, those sorts of things, oral hygiene. They may need help with transferring. They may be on hospice and need bedside care, those types of things. And it's not a la carte service. It's just our service is broken into levels of care. So if you're on the higher end of that level, you're going to be at the higher end of our pricing. Likewise at the lower end. Referral agencies tend to be a little bit cheaper than us. not dramatically, but a little bit. And then private caregivers are going to charge what you negotiate with them, and they tend to be a little bit cheaper too. So when you're using a full service agency like mine, again, you might be paying a little bit more, but the advantages are the background checks, the backup if something goes wrong, the ability to swap out a caregiver that you don't really care for, and you don't start from ground zero. I get you somebody else that I think is going to be a good fit. We talked a little bit too about how to have the conversation with your clients and how to broach the subject of in-home care or residential care or those sorts of things. Basically, what it boils down to with most of my clients when I have those conversations with them is what their priorities are. Oftentimes, it's my priority is I want to stay in my home and I want to be safe. A situation like using somebody like me might be a good fit because they can stay in their own homes, they can stay in their neighborhood, and their family knows where they are. Maybe they just need an extra set of eyes on them for a little while, and that's something that we can certainly provide. Some of my clients, their priority might be purely financial, where they can't necessarily afford to go to a residential care facility of some sort. And again, Julie and I talked about the types of residential care facilities that are out there, and there is a vast number of different versions these days. There's independent living, there's assisted living where you get a little bit of help. There's the old-fashioned nursing homes, those still exist, or a board and care where you have eyes on you 24 hours a day. There's memory care situations. So there's a lot of different options. Those tend to be a little bit. I'm sorry, I thought I heard a question. Those tend to be a little bit pricey depending on exactly where they are and what services they provide and that sort of thing. And that's certainly something that can be a good option for a lot of my clients. But again, the decision making is usually done by a family member. It's usually a family member that sees something that makes them a little concerned about their family member, either their safety or oftentimes it's little things like diet. They go to mom's house and they realize that there's no food in the refrigerator, or the food that's in there is expired, or they only see, in the garbage can, they only see empty Cheerios boxes, and no fresh food and that sort of thing. And that's something that if a client does want to stay in their own home, that is something that we absolutely can help with. We can provide transportation to take people grocery shopping. We can provide, or we can do it for them. Some of my clients are safe to be alone, and we can actually leave them and go run those errands for them. We can do meal preparation for them to make sure that they are getting healthy meals on time, things of that nature. So, and again, oftentimes just getting somebody to accept that type of assistance is the hard part. And again, like I said, it's the figuring out what their priorities are versus what their safety situation demands. We also can provide what we call care management. And that's another service that my company provides that you might not necessarily get from an independent caregiver or referral agency. I have a nurse on staff, and she can't perform any medical procedures of any sort, but because of our licensing, not because of hers. But she can do things like attend doctor's appointments and be a medical liaison for the family. She can make sure medications are set up appropriately and the schedules are provided to my caregivers. She can do a lot of things of that nature, and oftentimes that'll give clients, not so much the client, but the client's family, a little more peace of mind that there is that extra set of eyes on the caregiver. The other thing that we do is we can work directly with hospice and palliative care organizations, where those agencies come in and they do what they do, and they're great at what they do. But they're in the home for an hour, maybe two, a couple times a week. and my people can take over where they leave off. We don't do the same exact things, but we augment what they're trying to do. Same thing with physical therapists, occupational therapists that are coming into the home. They tend to do the same thing. They come in, they provide some exercise, they leave homework for the client that the client may or may not do without the therapist there. My people can pick up where they leave off and assist with that. It could be as simple as taking them for walks in the neighborhood, making sure they're safe while they're outdoors getting some fresh air. It might be actual stretching exercises, or even I've had a couple of clients that even had relatively rigorous calisthenics assigned to them that they were afraid to do when they were home alone. And so having somebody there with them while they're doing it can be quite motivating. Some of my clients will have cognitive decline and just need simple supervision. I have caregivers that are that have advanced training in advanced for my industry training in Alzheimer's and dementia care. They know how to deal with people that may need some redirection. They may need assistance with simple tasks, or it could be as simple as sitting down and doing a puzzle with them to keep them focused, to keep their brains working, or crossword puzzles, or there's lots of different things that clients in those situations do that my people can help with. Now I feel like I'm starting to give a commercial just for my agency, and that wasn't my intention. Does anybody have any questions on what I've talked about so far? No? Okay. I can talk about a little bit about the process of hiring an agency like mine, if that would be beneficial to you. I can further highlight the difference between a licensed and a non-licensed agency. There's got to be some specifics that you guys are hoping to get out of this conversation that I'm missing.
Well,
That
yeah,
was
I do have
my
a
question.
question. Who was talking? McGlinty?
That was me. I mean, he hit right on it. I got on late, but I wanted to know about your fee arrangements with your clients.
Okay, so basically the way it works with our agency, and I can only speak to mine, probably very similar for most agencies. State law requires us to pay our caregivers weekly, so we bill our clients weekly, and for us that ranges between $44 and $46 an hour. We are more or less right in the middle of the road as far as full service agencies. We make sure we're charging enough that we can attract good caregivers, but not charging so much that we chase off all of our clients. So we are right in the middle of what most full service agencies are charging. The ways people pay us, we live in the Bay Area, so some people can just afford that without batting an eye, and that's great, good for them. A lot of people cannot. So what usually happens is family members chip in. Oftentimes, it's the kids that help out. The other way people pay us is if they have long-term care insurance. I'm not sure how familiar you all are with long-term care insurance. It's great if they have it. It can be expensive, but it does cover a good portion of our services in most cases, especially if it's an older policy that they've been paying on for a while. The newer policies aren't nearly as good, but some of the older policies can cover up to 24 hours in-home care, which is great. The other thing that some of my clients do is if they have VA benefits, we work directly with the Veterans Administration, and they actually provide a certain number of hours depending on the needs of the client per week.
So you are connected with aid and attendance?
Yes, we are. We have right now we have 70, I believe it's 72 VA clients that we provide service for, and I only know that number that accurately because we give them gifts every Veterans Day, and so I'll be delivering 72 pies next week. Me and my
Nice.
So yeah, I actually have my oldest client is, I think she's 102 this year. It's a female World War II vet. She was part of the Women's Army Corps during World War II. I love going to visit her. She's great. And we only see her a few hours every week. She's more or less independent at 102, which is awesome. But yeah, we work with aid and attendance. We work with there's other programs that the VA has that we can work through with some of my clients where they actually get compensated to have a family member work with their own family members and get compensated. I forget um, what that one's called, but we'll provide training and support for the family member. There's a lot of different things that we do with the VA, and I'm a vet myself, so that's my favorite part of this is when we get to help out vets that didn't even realize, oftentimes that didn't even know that they had VA benefits, and we can help them work through that. So yeah, it can be expensive, but there are options out there. And like I said, our pricing is kind of middle of the road. I've heard as high as $55 to $60 an hour from some other agencies, which I don't know how anybody can afford that. But and again, if you come across a client that needs home care and they absolutely cannot afford something like me, and they don't have those other financial support options, there are other options like in-home support services through the county. Again, you're going to be hiring a private caregiver. You're not going to be working with an agency like mine, so some of the liability is not relieved like it would be using a full service agency. But for clients that absolutely can't afford anything else, it's also a great program, or can be a great program.
Lynn, you had a question?
Yeah, so thank you for that question regarding the finances because it is important. What about, because their nest egg obviously is in their homes. And so I actually was talking to a senior couple this weekend and they're like, can we use a reverse mortgage to pay for like our care if we move out of the home and rent it out? And I'm like, I don't think so. I think reverse mortgage is just for primary residence.
I'm 99% sure you are accurate. I actually have a friend that he specializes in reverse mortgages. And when I come across a situation like that, he can also do HELOC loans and things of that nature. I usually connect them with him.
Oh, okay.
And he'll actually be present on Thursday if anybody is coming to the event. He is very good at that. Providing information, and he's also really good about not charging for consultation or anything like that.
Oh,
He's
yeah,
happy
I
to
have
talk
a
to
friend
anybody.
too, that David Butler, he does.
Yeah.
It is David.
That's who I'm
Oh.
talking about.
Yeah, it
Okay,
is
well,
David,
he's
and
everyone's
David
friend.
will be at it is David, and David will be at the Senior Living Communities Showcase on Thursday.
Yeah, he
So,
was
yeah.
my children's seminary teacher, and he also helped with my son's wedding. So what? And he's my pickleball buddy. So yeah,
Oh, very nice.
we
He's
know.
been
What's that?
trying to get me to show up for pickleball, and I'm afraid my knees won't.
Oh,
won't
you should
survive.
come. No, everyone here should come just
Yeah.
because your knees. I have bad knees too, but I still play pickleball and walk 10,000 steps a day. So you can do
Okay,
it.
where do you play pickleball at?
It's in Saratoga. Do you guys know? It's at our church, at the Church of Jesus Christ of Latter-day Saints, which
Oh,
is
okay,
right
yeah,
next
I
to
know where
West.
it is.
Yeah, we're right next to West Valley, but yeah, but some days we have it, some days we don't. So get my cell phone number and text me. This week we don't, but we have it next week, so I'll be there.
Gotcha.
Yeah, it's
But-
David. So yeah, he can answer those questions for you, Lynn. And yes, you are correct. It is on primary homes, specifically. However, there are some strategies that David knows about and that we'll be able to talk about.
So is it common usage if you're living in a home and you prefer not to go into assisted living, to have caretakers paid for by a reverse mortgage?
I would not say it was common. I have seen quite a few of them. I've also directed people to David because I think it's a viable option for them. A lot of people still remember back to the 2020, that TV show 2020, where they did that expose on reverse mortgages in the 70s and 80s and how it was such a horrible option. And, these poor old people were on the street with their suitcases because the bank closed on them. Reverse mortgages are not like that anymore. They're actually a viable option for for a lot of people, whether they're aging and looking for support or not. And like I said, David's been trying to educate me on it a little bit so that I can speak more intelligently about it, and it just hasn't quite stuck yet. But yeah, it is absolutely a good option. I do have quite a few clients that have gone that direction. And you're absolutely right, Julie. A lot of people in this area, they may be cash poor, but they're house rich. And if they really want to stay in their home, there are financing options that they can look into. And we don't specifically do that, but I keep people like David around so that I have resources for them.
Good conversation, Lin.
And she
So
didn't.
do you do now if we have conversations with families, do you do an initial consultation or evaluation?
I absolutely do. We call it an initial assessment. And I meet with them. I don't charge anything for it. I'm happy to meet with anybody and to discuss options with them. And I do prefer to do it in person with them. Because for a lot of reasons. Oftentimes, when I have a phone call with somebody, 5 minutes after I hang up, they have 10 more questions. Usually, I can get all of their questions answered when we're in person. It also, the thing that I really like about doing it that way is I get to do a home inspection if they want it. I get to take a look and make sure that that they're set up and there aren't any pitfalls in the home. Little things like throw rugs or light furniture, or when they're turning corners, I see clients all the time grabbing onto light furniture, and it scares the heck out of me because it's just it looks like a fall waiting to happen. But it also gives me a feel for their personality and what their priorities are. It helps me choose a caregiver that I think will be a good fit. Obviously, the most important thing is that the skills of the caregiver match the needs of the client. But it's also important to have a personality that's going to match. I mean, it's a big ask to say, hey, can you send a stranger to my home and help me take a shower? I mean, and I'm very sensitive to that. And so I like to be able to choose somebody that's going to be a good fit, that they're going to have the ability to develop a rapport with the clients, and kind of like that old Hair Club for Men commercial. I'm not just the owner, I'm also a client. I've actually used my services for 3 different family members over the years, and so I've seen exactly what it feels like to be on that side as well. Which is why another reason I like to do it in person, so that I can really assure people that we are out for their best, to fulfill their needs, and I'm not just looking at my own bottom line.
So as far as attracting really solid, good, talented caregivers, what's your philosophy about that?
So first off, we require that all of our caregivers have at least 1 year of non-family experience. We also put them through a background check. The state actually is the one that says whether or not they can work for me. I don't even get to make that decision. As far as attracting them, we take very good care of our people. A lot of our recruitment comes from caregivers, bringing a friend in, bringing a family member in. My daughter actually runs our HR, and she's going to job fairs, and she's going to the nursing schools and that sort of thing. So we do a lot of marketing in that regard. And we're constantly hiring. There's never a moment that since I've only worked for the company since 2018, but there hasn't been a moment since I came to work for the family business that we weren't actively hiring. But if they have that year of experience and they pass the background check, they come in for an interview. They usually interview with 2 different people. And then after the interview process, if we do decide we're going to move forward with them, they go through onboarding training that is put on by our HR department. It's supervised by our nurse. And that onboarding makes sure that they have at least what we would consider, what the state considers level 2 experience or level 2 knowledge, the ability to provide assistance with seniors, how to properly attend to personal care, those sorts of things. They don't necessarily, not all of my caregivers want a client that has, that many needs. A lot of my caregivers, they just want to do the companionship and the housekeeping and the running the errands, and that's totally fine. We'll match them up with a client that's all they need, but we want them to at least have that level of knowledge. so that if things do change with their client or whatnot, they at least have the background knowledge. We also offer ongoing training, more advanced training, such as using special equipment to provide transfers like a Hoyer lift or something like that. Training that involves dealing with clients that do have cognitive decline, such as dementia, Alzheimer's, those sorts of things. We're always trying to provide ongoing training, making sure people have the most up-to-date information as far as the industry standards for taking care of our seniors. And then the other side of that is I'm a retired police officer, so I tend to not trust very many people at all. So basically, if they get past me, they're probably going to be a pretty decent person. And again,
Well, that was going to be my next point, because how do you prepare a family and a client to receive a caregiver in their home so that their home is safe for them and the caregiver? And then just quickly, because I have a family, client that their family member in Las Vegas got hoodwinked by this kind of caregiver, but she came into the home and completely gutted their bank account and things like that.
so that does happen. Doesn't happen with us very often because of the background checks and the supervision that we provide. But I hear horror stories like that all the time, which is certainly one of the benefits of working with a full service agency that is licensed and bonded and insured. If something like that were to happen with my clients, they would be covered. Not that necessarily helps depending on what is lost. If it's just money and it gets replaced, that can be quite difficult. We don't have those types of issues. We have had some accusations, and being a retired cop, I guess who gets called on to do the investigations. And I've usually been able to, well, I'll tell you exactly what happened in 3 cases. One of them was a pair of diamond earrings that I found in the garbage disposal. One of them was an antique knife that I was able to prove never even existed. And one time it was a Rolex watch that I found it had fallen behind the shelf in the safe. It was never actually taken. My caregiver obviously didn't have access to the safe. So we're 3 for 3 on solving those problems. But the big thing is really is preventing them. We don't like our caregivers to have a lot of direct contact. Like today, everybody has a cell phone. Everybody uses a cell phone to talk to people. We actually discourage our clients from having direct contact with that, partly because it can oftentimes it can head off any type of a sweetheart scam, but it can also head off the appearance of impropriety. Oftentimes some things just look bad. So that's one of the things that we talk about. We also talk about with the clients, never loaning anything to the caregiver, never giving the caregiver anything, not exchanging cash with the caregiver. We have a program where where a client, if my caregiver is running errands for them, obviously the client has to pay for it. But we're associated with a company that provides a reloadable gift card that the client can control. That way, even if the caregiver does do something untoward, it's a specific set amount of loss. It's not they don't have access to the whole bank account, things of that nature. And I always have that conversation with clients, and I try and let them know that these things do happen. And like I said, one, that's why you're working with a full service agency and not just somebody you found on Craigslist. And 2, the things that you can do to avoid it, which is the things that I just mentioned.
Okay, Nadia, you
Nadia's
have a
been waiting for
question?
you. Wait a minute. Nadia's been waiting. Go ahead.
Yeah.
Thanks. Just on the security, the issue that you mentioned, is there any sort of camera system, of course, for safety of client, but also for the caregiver, since you're dealing with patients of dementia? Do you have anything like that?
Oftentimes, if a family member has a concern like that, I will recommend they get cameras. That can be quite helpful. We also have a system that we can put in homes that we do not charge for. It's called Sensi, and that works on audio, not video. But that can give us, it can give us care-related data about the condition of the clients. It can also give us data based on conversations that the client has with my caregivers. It uses AI and pattern recognition. It's a really good system, and basically, a lot of people think, oh, when I start pitching this system, they think, oh, you're putting Big Brother in my house and it's going to be monitoring everything I say, and that's absolutely not the case with this. It does work on audio. It does capture conversations, but no human can listen in real time. But it will give us an alerts if certain keywords are used, different things. If there's angry voices in the background, we will get an alert. If there's conversations that sound like it might be some sort of a manipulation or taking advantage of a client, we'll get alerts for that. But it also, and those aren't the things that the system was actually designed to do. It just does those things, and I'm very grateful that it does. It's really designed to give us, like I said, care-related data. We get alerts for fatigue. We get alerts for respiratory concerns. So, like if a client's wheezing more today than they were yesterday, we might get an alert. The other thing that I really like about it, if the client calls out for help, we will get an emergency alert. Whereas, with the emergency alert pendants, they have to push a button or they have to make a phone call. Even the Apple Watches require manual input from the client. Our system doesn't require that. Literally, if you were to call out for help or even moaning in pain, we would get an emergency alert. Oftentimes, clients, if they do have dementia or Alzheimer's or they have a fall, they don't necessarily have the presence of mind to push that button on their pendant or on their wristwatch. So we've had really good results with it. But again, it also gives that secondary benefit of giving us alerts if keywords are being used or something's going on in the background.
Michael, I have two other questions. Is there a minimum or maximum number of hours that you guys require?
I'm glad you asked that, because that's something I normally speak of right at the beginning and I completely forgot. Most agencies do have some sort of a minimum. Our agency is one of the smallest minimums as far as the full service agencies go. We have the shortest shift we'll do is 3 hours, and we have an 8-hour per week minimum, which is these days is actually very low. Pre-COVID, we had no minimums, and it was great. I loved it because a lot of my clients would do 2 hours in the morning, 2 hours in the evening. I called it getting them up and putting them away, and it was great. A lot of the labor regulations and such have changed since COVID, and so we've had to install those minimums. But like I said, we are still one of the lowest in the industry. There are agencies out there that will only do 8-hour shifts. There's agencies out there that will only do 20 or 40 hours a week. So we do maintain those super low minimums. If one of your clients absolutely needs less than that, then you have the options of the IHSS or referral agency or private caregiver. There are private caregivers that'll do shorter shifts. But then again, you have the pitfalls of working with them versus working with an agency like mine. You also mentioned maximums. There are no maximums. We'll work 24 hours a day, 7 days a week. We have clients that we provide what we call live-in care. And that's where my caregiver goes and they actually stay in the home for 3 or 4 days, 24 hours a day. There's some restrictions that are required for that type of service that the state requires. They need 5 hours of downtime in a 24-hour period. They need a place in the home kind of separated so that they can take care of their own personal care needs. But like I said, they'll stay there for 3 or 4 days, and then a different caregiver will come and stay for 3 or 4 days. And then that first caregiver will come back. We don't allow them to stay any longer than that because we call it live-in care, but we don't want anyone to think they're actually living there. We don't want them to set up what's called a right to tenancy, because I won't bore you with that, but
what kind of pricing do you charge for the live-in?
So for live-in, we charge a flat rate. And again, it depends on the level of care. It's either $9.25 a day, $9.35, or $9.45 per 24-hour period. And that sounds like a really huge number. But if you were to do the math of $44 times 24, and factor in that everything over 9 hours is billed a time and a half. It's overtime. That 925 is not as big, not quite as big a number as it sounds. We do absorb a lot of the overtime costs in that regard, for the mere fact that it's much easier on us administratively. So we do absorb some of the overtime.
I get it. Also, Michael, Jessica Solomon here. I just spoke with somebody recently at the Home Care Association of America on Capitol Hill, and come January, hopefully, fingers crossed, they're gonna eliminate the overtime, which is what we need.
Yeah, I'm hoping that some of those regulations are going to relax. We've already had internal conversations about what our live-in pricing will be if that does in fact change. And our price is going to drop dramatically. And I'm very hopeful. I think that I have a lot of clients that could benefit from that type of service, and would prefer to stay in their own homes with that type of peace of mind rather than having to uproot and go to a facility.
So the client, Michael, has to pay for the 5 hours downtime that the caregiver has if they're doing the full day?
They do pay for that time because it's a flat rate pricing. So it's not 5 hours charged hourly or anything like that. That's one of the reasons why we do the flat rate pricing versus hourly in those situations. Now, some of my clients actually do need supervision 24 hours a day, and that live-in pricing may not be appropriate. It may not be appropriate to allow a caregiver to get 5 hours of downtime. And so we can actually do those types of cases in shift work where we do 3 8-hours or 2 12s or something of that nature. I have one client that really likes their daytime caregiver, and they have that caregiver for 16 hours. They're willing to pay the overtime, and then they have an 8-hour shift overnight with a different caregiver. So there's lots of different strategies that we can employ for somebody who does need 24-hour supervision, especially clients that have some cognitive decline, or they have a sundowner situation, or they're wanderers. Giving that caregiver those 5 hours of downtime may not be appropriate. Also hospice clients that need to be repositioned in bed, something like that. The live-in is not an option for some of those clients, but for some clients, it's a great option to have, especially for the peace of mind of the family members. Oftentimes that's the reason we're doing it. We don't care if the caregiver is asleep as long as they're close by in case dad needs something. And so it can be a great option for some people.
Excellent.
Yeah, I have a question with these prices, and I'm thinking about a friend that I just talked to yesterday, and she's in need of some of these services, but she does not have the income to do it. So does Medi-Cal kick in somewhere?
They do not, unfortunately. There was a pilot program back east where Medicare was actually there, or I can't remember if it was Medicare, it was their version of Medi-Cal, that was exploring it as an option, because we can show that having in-home care reduces readmissions to hospitals or skilled nursing facilities dramatically. And so I wish they would get on board with it. I mean, it would be great for me for business, but it would also be great for a lot of my clients if they had that ability to use some of those benefits to pay for it. And unfortunately, in California, it does not.
See, this is another case where long-term care insurance would cover it. And
Absolutely.
Right.
Yeah.
Right. But these folks are beyond that. So I'm
You're-
saying, what's the
Mickle and
solution?
Or home
Mickle,
equity,
they're,
or the home equity.
yeah, or they
They
might
don't have that
qualify
either.
for the PACE program with WellBe Health.
That's a possibility. Yeah, I can look into that.
That is an option, and IHSS is another option. In-home support services through the county. They will pay for a portion, if not all of it. But again, that you're hiring a private caregiver in that circumstance. You're not getting the benefit of an agency. But if that's the best that they can do, it's absolutely better than nothing. At least they have somebody coming in and having eyes on them and giving them the support that they need.
Or sometimes the mix. I always tell people, look, if you can't afford the home care, an agency, they can't supervise your caregivers, but at least you have some level of oversight, professional oversight, and everybody's on their toes. Everybody's on their toes. Everybody is like very confused about what Medi-Cal, Medicaid, will get for you. And, the reality is nothing anymore.
Unfortunately.
And I really, my heart goes out to all the families that are like trying to comb through every option and overturn every stone. But this is like, some would say we're in an epidemic right now. You haven't even begun to see what we're gonna see in this
Mm-hmm.
this arena. We're not even
Mm-hmm.
close to the beginning. Not even close.
Some estimates say that by 2030, the over 65 population just in the Bay Area is going to double. And that's only five years away. So that'll almost be me by, I missed that estimate by about a year, but
Also, that if you're born in 2000, you're going to live to at least 100. So, we have to start thinking about what that physically looks like as levels of support. But I really hear you, and I think that I didn't mean to interrupt or anything like that, but like I really kind of like support like everything that you're saying is just so like above
Well,
and
yeah,
beyond.
this is exactly one of the reasons why we're doing this for our group, because that just makes us more informed. I want to say hi to Cheryl. Thank you for being here. Did you have something to add or a question?
I'm adding it into the chat. I was gonna say there's also just sometimes senior centers that, and I know like I'm in Contra Costa, so I know that sometimes there's day programs that are very inexpensive for the day. It's like $25 to drop off. Caring Haven is in Antioch based, but I believe in Concord, they have some sort of day program as well for people with need dementia support. They also have assistance for like their caregivers for like that role strain that we have when we're caring for our loved ones. So I know that they have some sort of call support. I'm putting their link on here too. So I think that they're like, and then you mentioned PACE, Julie. So I think that there are, again, not as much, right? When it comes to insurance coverage, but there are a few things out there.
and there are so we provide service in 4 different counties, and all 4 counties do have there are those types of resources, the senior centers and the daycares and that sort of thing. They're quite prevalent in Santa Clara County, and there's a couple that are really, really good. And that is certainly an option for somebody who is, just unable to pay for in-home care. There are those types of options for sure. You're not getting necessarily the same personalized care that you might get from a caregiver or in an assisted living, but you absolutely know that your family member's safe when you drop them off there, at least for the time that they're there.
So for the family member caregiver, do you and specifically address caregiver respite with what services you have available?
That's one of the main reasons we try and keep our minimums as low as we possibly can. We have a lot of clients that's exactly what we do. We go in for 4 hours twice a week, and that family caregiver, that's their chance to get out and refresh and recharge and go do what they need to do. That it's quite common for our services to provide that. I jokingly tell people all the time that the vast majority of my clients, we're ostensibly we're there for the senior that's in the home, but the person that's really getting the benefit out of it is the daughter that, has to run her kids to baseball practice and know that, her mom is still safe while she's out doing that. And so that's one of the reasons why we absolutely try and keep our minimums as low as we possibly can so that we can provide that service.
Yeah, because the caregivers need the care.
Right.
And pretty soon, well, data's already coming out where the caregiver is going to expire before the family member.
That doesn't surprise me. I haven't read that actual data, but that doesn't surprise me in the least. And there are organizations, there's support groups, there's a lot of support that can be found out there for the caregivers themselves, from training to support to emotional support, and that is absolutely very valuable. In fact, the VA is kind of one of the leaders in that, where one of their programs, it doesn't provide any financial support to the clients, but it absolutely, they have classes, they have group sessions and that sort of thing for the family caregiver. And it is absolutely important that the family member gets that support too. And yeah, I'm glad you mentioned that.
And okay, Nadia, go ahead.
Just a quick question. Thanks, Julie. Michael, are these caregivers, are they able to do CPR or do they speak other languages?
Yes, they are capable. Believe it or not, there is no requirement that they be CPR certified. A lot of my caregivers are CPR certified. I have some that are advanced first aid certified, but there's no requirement in our industry that they are. So some of my caregivers are, and some of them are not. And I'm sorry, what was the second part of the question?
Do they
Speak
speak
multiple
other
languages.
One more time, you broke a little.
I was asking if they speak other foreign
Oh,
languages.
foreign language. I actually maintain a list of clients that speak different, or I'm sorry, a list of caregivers that speak different languages. Most of my caregivers do have a second language, and like I said, I maintain a list so that I can try and match them up with a client that needs that. I'm not as successful at doing that as I would like. All of my caregivers are required to be able to communicate clearly in English. So even if the client only speaks a different language or has limited English, my caregivers are required to be able to communicate in English. I have successfully connected a Japanese speaker with a Japanese client who only spoke Japanese, and that made me very, very happy. I have a couple of clients that speak Tagalog, or a couple of caregivers that speak Tagalog, and we try and match those with our clients that have those language blocks and that sort of thing. I try and recruit caregivers that speak multiple languages, but you'd be surprised how difficult that can be even in the Bay Area. But yes, that is absolutely something that's taken into consideration if we can make that match.
Michael, I did put on the chat. Do you, I put my information on there. Do you work with any care management companies?
So I have some care management resources and different people that I can put you in contact with. My nurse does do some care management. It's not quite as in depth as somebody who specifically provides care management. So I do have some resources in that regard. We don't do a whole lot of, strangely enough, I haven't had a whole lot of situations where we work together on clients. Usually I'm giving them clients or they're giving me clients because they need more of one than the other. But I do try and maintain relationships with outside care managers in case they become necessary. In fact, I try and be a resource for my clients as much as I possibly can, as far as referring them out to different disciplines or different agencies. And I'm always happy to provide referrals if I can, even if it doesn't get me any business. I just want to make sure that the seniors are living long and living safe.
What's your lead time? Because sometimes we encounter families that are having an emergency situation.
So we ask for 24 hours notice. I've staffed cases like same day many times. I tell people all the time, if we ask for 24 hours notice to make sure we can hook you up with the right person. But if you need somebody right now, call me and I will do what I can. I don't have people sitting around my office waiting to be deployed like the military, but I can often do same day things. It happens often. Many times I'll get a call from a client. They're in skilled nursing and they're about to discharge and didn't even know my industry existed until the social worker told them, "Hey, you need in-home care." And they're like, "Okay, what's that?" And they'll say, "Okay, we'll call Michael." And oftentimes I've been able to have a caregiver waiting at the door when they get home from the skilled nursing. So the short answer is 24 hours, but by all means, we will work on an emergency basis if we need to, and we'll get people the support that we can.
Well, that's good to know because, it's always an emergency when by the
Right.
time we end up hearing about it or seeing something. Yeah.
Yeah, it happens at least once a week where we get one of those calls where somebody like usually, like I said, they don't know what they don't know until it's upon them, and
Mhm.
they're scrambling to either get a ride from the skilled nursing or to have somebody present when they get there. And we're happy to do what we can. I'm short to promise because I like to under promise and over deliver. But we generally can do things on short notice, same day type situations.
Awesome. Awesome. Thank you.
And
Um,
somebody asked for my contact info, and I'm typing that right now. If it looks like I'm doing something besides listening to you, it's because I'm typing my contact info, but I'm still listening.
and I'll have all of his information in the bulletin as well.
What bulletin?
That's so funny. You're so funny. Um, does anybody else have any questions, comments?
So I guess, sorry to be so naive to, all of this, but, in terms of paying for the care, do you guys accept, insurance or is it strictly out of pocket?
But the only insurance, unfortunately, that we accept would be long-term care insurance.
Oh, okay,
Regular medical insurances do not cover us.
okay,
At any point, because even though my caregivers are highly skilled as far as the industry is concerned, we're considered non-skilled. So medical insurance doesn't cover us. One thing I forgot to mention, some of my clients have had universal life or whole life policies, and those have actually provided some living benefits.
Mhm.
I don't know if anybody is super familiar with insurance, and I don't want to get into the pros and cons of those types of policies because I've heard
I
some
actually
stories
have
about
one of
that.
those. I don't know what it's called, but somebody introduced me to a Dan Foss. I don't know if any of you guys know him. He actually lives in Willow Glen, and he does a type of insurance which is a hybrid. So what it is, it's like a life insurance that I'm just going to make it really simple. So for instance, if I get a $1
I
million,
can help you here.
oh,
It's a, the hybrid insurance is a life insurance with another type of insurance, usually long-term care insurance
yes.
associated with it. It could
Yes,
also be an annuity. So the way that you use it is that you use either or. So
yes,
when you buy the policy and you never have to need any care, it'll go as a life insurance policy for when you die.
correct.
However, if you need the long-term care, then that part of it will kick in and there's no more life insurance.
From what he's, thank you, Skip. Yeah, from what I understand, from this policy is that if you do tap into the long-term care costs or to take it out for long-term care, that part of it just gets taken away from what your eventual death benefit. So it's
It,
not
de-
a all or nothing. You could, like, for instance, if you got a $1 million policy and you use 500,000 of it for long-term care, you actually get remaining 500,000 for your death benefit of the
yeah,
life.
the bucket of money. It depends on the company and the policy, but
Right.
typically it's an either or.
Oh, okay. Well, that's, I mean, unless I misunderstood. That's what I understood mine, because we are paying every month for that.
Well,
A
it
chunk.
could be. I mean, now you could have the policy that just looks at the bucket of money and you get to choose which one of that you want to put it into. But typically it's one or another, but
Oh,
I,
okay.
that's up to the
but
individual policy and the company that underwrites the insurance.
But I
Well,
think this is interesting that Lynn, you have these questions and like who sold you the policy? Like this is another piece of the industry people don't understand. Michael, I was going to put you in touch with Care Scout. I don't know if you have you're credentialed with Care Scout, but Care
Yeah.
Scout, yeah, is like, they're funneling people that they have credentialed that are, going into claim.
Mhm.
Genworth or John Hancock and all that. And they're really, it's so telling what's happening with the market right now. And you see these emergencies. I mean, Care Scout just purchased Seniorly. I know that doesn't mean anything to anybody on this phone call except for Michael and me or Cheryl, but this is just showing you the sign of the times. And the thing is, how come you don't know? How come you're not clear? I'm not trying to, spot you out, but do you have somebody who sold you the policy? Are they even still around? Or do
Oh,
you?
yeah.
Okay. I was gonna say, or like, is there a long-term care agent that we should be connecting you with in your area that would be happy to like review the policy with you?
Well, that would be Skip, so.
Oh,
In our
okay.
group. He's
Oh, good.
he's an expert on that.
Oh, okay. Then I'll get a hold of you, Skip, and maybe we can.
Yeah, I sell long-term care insurance too.
Oh, okay. Okay. Yeah.
Do
So
you sell
that's.
cars? What else do you do, Skip?
Well,
Not
yeah,
quite.
so Michael, coming back to the just in general, you said the industry in general does not accept any health insurance. I mean, yeah.
Right.
Is that so any care agencies will not take like Medicare or
It's not the industry that refuses to accept it. It's the insurances themselves do not cover our services.
Oh, I see. Okay, got it.
But
I would love to take Medicare. I
yeah,
absolutely would love it.
but we have people fighting every day getting denied by Medicare. Like there's just not enough to go around anymore for
Right.
anybody. So it's definitely we don't have enough around to go medically with Medicare. So there's definitely not going to be Medicare. A lot of people thought that got into this industry, they felt like the government was going to be starting to pay, there was going to be a shift there, but there's
Well,
no way, no
okay.
how.
Okay, but caregiving and medical care are two different things.
Because
Correct.
caregiving is non-medical. It's
Yeah,
not
it's
skilled
non-medical.
care.
Yeah,
It's custodial.
it is.
That's why
Custodial.
long-term care insurance pays for activities of daily living, cooking, cleaning, dressing,
Yeah.
bathing. That's not medical.
Right.
Mhm.
Mhm.
So
Nadia?
Michael, sorry, one more question. And I forgot who was it here that was talking about loneliness. I thought we talked about, maybe it was last week. Sorry, maybe I'm
That
getting
was last
dementia.
week.
Yeah, it was
Was
last
that
week.
last week? Okay. And then there was another comment. I don't know if it was Mike Scoggins. Somebody made that the caregivers typically, because I don't know if and I know I'm sorry to be so un-PC, but
Mm.
sometimes if the cultures are not matching and all that, there could be a certain degree of even feeling lonely, even if you have the caregiver there to as companionship. I mean, I'm sure there's a whole scale of caregivers, ones that sit in the corner with their phones. I mean, hopefully not, while they're there, but ones that really interact with the client by, asking them questions about their lives, playing board games together. I mean, so how do you qualify or how are your caregivers monitored that they are actually interacting with their client and not just sitting in the corner on their phones,
So that particular caregiver that sits in the corner on her phone, she did used to work for me. She doesn't work for me anymore. That drives me crazy. I hear people complaining about that, not necessarily my caregivers, but I hear that often people will ask, well, why should I pay somebody? They don't do anything but sit there. I don't want my people doing that. The way we get around that, it starts with my initial assessment where I'm talking to people, I'm getting a feel for their personality. I'm trying to determine what their safety needs, of course, and their personal care needs, but also their activity needs. Whether they need somebody who is encouraging, that's going to, say, hey, let's get up, let's go do this, or let's play cards, or let's. And I have, I know my caregivers, so well, my staffing people know them better than I do, but I'll make those types of requirements for that individual client to the people that are helping me do the staffing and say, hey, this person needs a drill sergeant. That person's okay with the meek and mild. So we do what we can to try and match those two types of personalities, but we also do supervisory checks. Where either me or one of my coworkers will actually go out and have a conversation with the client and say, what's going well, what's not going well. We stay in contact with the family members because family members usually know that that's going on. That they're getting what they're supposed to be getting. Also, the Sensi system that I spoke about, that can give us some insights if those types of things are occurring. And no amount of supervision is going to prevent that one-off case where that is occurring. But as soon as we hear about it, we address it. I also have a paragraph right in my paperwork that's it's called caregiver compatibility, and it was written by a lawyer. But basically, what it says is, if you don't like the person I sent, tell me. I'll get you somebody different. And so if we do come across a situation where a client's not getting the appropriate benefit or the appropriate engagement for that individual, we'll make a change.
Okay, thank you so
Okay,
much, Michael.
Nadia.
Just wanted to know what are the areas you serve, Michael?
So anywhere in Santa Clara County, San Mateo County, Santa Cruz County, or Contra Costa County. The lead time question that I got earlier is across the board, except if they live up in the mountains in Santa Cruz. Sometimes I can't do that on super short notice. And my Contra Costa office is a little bit smaller, so lead times up there can be a little bit longer. But generally speaking, those are the 4 counties we provide service in.
Mhm.
And if you're in Alameda County and you're close to Santa Clara or Contra Costa, I might be able to help there too, because I can. It's not there's not a border wall built there yet, so my people can go across a little bit.
So does their time, your caregiver, does it start before they're inside the house or?
No, their time starts when they get there,
Okay, thank you.
and they actually clock in and clock out on us we prefer they actually use the client's phone to do that, so I know that they're physically in the home. If for some reason they don't use the client's phone and they're using their own phone, then it has to have GPS enabled, so they can't say, "Okay, I'm with Mr. Smith," but they're really at the boardwalk. So we're pretty cognizant of that, and we, if a caregiver's late or whatever, we take that into consideration. We're only charging from the time they step onto the property until they leave.
And if they get injured, Michael, on the premise, I know you said you're licensed and insured and bonded.
Yeah, I'm responsible for workers' compensation. One of the huge differences between using an agency and hiring a private caregiver is exactly that. I've heard horror stories of, day one, the caregiver trips on the threshold and says, "My back hurts," and the client's on the hook for that. Not the case with us. We're responsible for workers' compensation.
Folks, I gotta jump off next week, robotic pets. I'll see you guys then.
All righty. Thanks, Skip. Okay, Mickelin.
Thank you.
Yeah, I want to go back to what Jess said about Seniorly. You said somebody took them over. I had a transaction with them. So are you suggesting that some of these smaller ones the bigger ones are gobbling up the smaller ones?
No, what I'm saying is like Care Scout Seniorly is a platform that routes people that are looking for assisted living will route them to, it could be a real estate agent, but probably in most cases, a senior placement specialist.
Right.
That's been their model for years. And I don't know how the platform will be changing, but what now Care Scout bought Seniorly, and so they're going to be highlighting communities or care homes that have been credentialed through Care Scout. So they're just trying to kind of highlight those ones to kind of get people to drive them towards the ones that their long-term care insurance.
Wow, that sounds like a huge nutshell. Like, yeah, we'll have to make a whole topic out of that.
Yeah,
I'm not
well, I
sure.
mean, it's just interesting.
Yeah.
The other one I had for Michael, and that is going back to the client I had mentioned. She's in a really bad situation, not only her health, and thank you, Julie. I remember it now that you mentioned PACE. I can go through that, but and she might qualify through Medi-Cal, Medicare, whatever, but that because I'm just running out of options in order to help her. The other one is her actual housing, because you have to be in your own home whether it's a rental or whatever. She is in her son's home, and that's another issue. He's already told her, you know, this is temporary. So it's like she can't even rely on her own family. So friends are coming in to sort of do a rescue for her. She's going to be there tomorrow, but I'm not encouraging her to say that this is the answer for her, because I mean, even though listening to Michael in some of these facilities, it's going to be out of reach for her.
But
So I
what about,
suggest that
what
a
about
place,
finding a community that with like an assisted living waiver? I mean, she doesn't qualify. She has no income, correct?
she has income, but it's not enough.
Well, then if she's open to going to a community or care home, she might have to start looking at ones that are under the assisted living waiver, or there's another one, I forget what it's called. It's kind of like the secondary part of the whole waiver program, but you know,
Yeah,
it might not be in her community, that's the
yeah.
problem. It's like she might have to go to another county or the county or
Yeah,
whatever one becomes available for her.
Well,
right.
and tomorrow, you can ask Mike about that tomorrow. Mike
Okay, I
Stockton,
will.
he'll know
I
about that.
will. I will.
Althea,
Thank you.
Althea, you had a question?
Yes, I just wanted to ask Michael, and I'm sorry I came in a little bit late, but what are the hourly rates? What do they range from?
So if you're using my agency, it's between $44 and $46 an hour. That, and like I was mentioning before, we're right kind of in the middle of the road as far as licensed agencies go. Some agencies charge considerably more than that. If you have a client that can't afford that, we did talk about, alternate ways of financing and that sort of thing. But they could hire a private caregiver. It would be less than that. Or like the conversation we were having, there are residential options that can be considerably less expensive. But there's pros and cons to all of it. But generally our pricing is between $44 and $46 an hour.
Okay, thank you so much.
Oh, my pleasure.
Well, I learned a lot, and I learned some new information that I didn't know before, so that's valuable. Did you guys learn something that you didn't know?
Absolutely. It's great. Thank you.
I'm glad I could be of assistance. I did put my contact information in the chat. At my old job, believe it or not, I carried 3 phones. I only carry one now. I refuse to carry multiple phones. So even if you have a question in the evening or on the weekend, that cell number is available to you. You can give me a call or send me a text. I tell people I'm not great at answering my phone, because if I'm with a client, I tend not to answer, but I'm great at returning calls, or shoot me a text. Or if you just need general information, I put the office line up there too. Or anybody that you talk to at the office is going to be either able to get a hold of me or provide the answers that you need.
So, and I really appreciate the information that you shared with us, Michael. We do have a couple of our participants that are in other parts of the country, and I'm sure that a lot of this information they can use when speaking with local care agency providers in their markets. Like Roni, he's from Long Island. Sherry's from Michigan. And then we are connected. Jess is in Central Cal, or what do we call it? By San Luis Obispo, Santa Barbara. Yeah.
I love it.
And we are connected nationally with our SRES group. So we are always talking to our colleagues in other parts of the countries, and especially about our senior homeowners. So we really appreciate that.
Yeah, I'm happy to be a resource, even if somebody is out of the area. I may not be able to speak too intelligently on, rules and regulations in their area, but as far as the general services and that sort of thing, I'm happy to answer as many questions as you guys can throw at me.
Well, thank you again. Tomorrow we're having the Senior Living Community Showcase. I put the flyer up and I've sent out the email. Everybody knows about it. Michael's going to be there. We're just going to have so much fun. So if you're in Campbell, anywhere close to Campbell, come to the Campbell Community Center at 10 a.m. to 2 p.m. We're going to have, go ahead, Valerie.
You said
Okay, not
it's
tomorrow.
Thursday. You
Oh,
said
I meant Thursday. I mean Thursday.
I was a little scared for a second.
Yeah.
Same
No,
question.
I mean Thursday. So my brain is scrambled eggs right now. Okay. Just doing all of this stuff, but I appreciate that, you guys.
Yeah,
All right.
I'm very much looking forward to it, and I'm happy to answer any questions there too as they pop up, or give me a call. That's what I'm here for.
Michael, did you put your email address in the chat as well, or just I just see the
I
phone
did.
numbers?
I did not, but I will do it right now.
Okay.
And I'll have all his information available in the bulletin. And real quickly, for our group, the website for our group is up and running. It's still a work in progress. The link to it is on page 1 of the bulletin. So check that out. That's where we're going to keep all the recordings, all the bulletins, all of our resources. It's a work in progress. Everybody will be stationed on there as resources. Eventually, that's what we're going to be building. So take a look at that when you can. All right, everybody. Thank you so much. Thank you,
Thank you.
Michael.
Bye.
Bye.
All right,
Michael.
everybody. Have a great week.
Bye. FS.